Today's topic is nurse and patient relationship. Stated by the American Nurse Association, trust is the foundation of the nurse and patient relationship. It is the basis upon which compassion, shared decision making, and an effective communication is formed. If you were in a hospital and had to stay for more than a day or so, would you want to be helped by a rude nurse or a kind nurse? So that is today's topic. I want to discuss that importance between the nurse and patient relationship. The way you react in this situation, whether you're the nurse or the patient, can really make a difference in your day, because you never know when it's going to be you that is hospitalized and needs help. So the way you act can really make things go a lot smoother. Also, trust and communication. Trust needs to be strong between you and the patient, because that can lead to a better diagnosis. As the patient, you want to feel comfortable discussing what's going on with your body. That way you can be treated correctly, because if you're shy about something, or you just don't feel comfortable with that nurse, you might not want to talk about what's really going on with you, and if that's the case, then you're not going to be treated correctly. So it is important to just build that trust with your patients. So as a nurse, you want to help your patients help you. The way people act, when they're in pain, can be completely different than when someone that's not in pain. So you don't want to take that personal. You have to feel compassion for that patient, and that way you're getting that correct diagnose, and they feel comfortable with you to discuss, what's really going on with them. Talk to other nurses. So if there's something you're not understanding, or you don't really know what to do, don't be scared to ask for help. Go out and ask other doctors, other nurses, discuss whatever you may not really know or feel comfortable with, just so that it's also helping you treat the patient, because you want to feel comfortable with what you're doing and positive with it as well. Another thing is job satisfaction. There's patients there that are there for 1 day, 2 days, a week, weeks, children, elderly people. Having someone go home after they've been hospitalized for so many days, that has to be very rewarding, because you did the job correctly, and you've helped that patient get better so they can go home to their family. That has to be very rewarding. There's and it's not always good for the nurses, because there is patients that have an attitude towards certain things, and so they're like that saying, happy wife, happy life. Well, in this case, the patient is the wife. So as long as they're happy, then they're going to make your life easy, and then therefore you'll be happy. So a happy patient is a happy nurse. Be confident in yourself. Another thing is, be confident in yourself. Don't be scared to ask questions. Like I said, go ask a doctor or a fellow coworker if you don't feel comfortable with something. Don't let yourself be bullied by other nurses or the patients, because there is going to be some grumpy patients. So just be with a positive attitude. That way the patient is positive with you as well. Don't let yourself be bullied, because there will be a lot of bullies, even as adults. It tends to happen, but you have to kind of work your way around that. That way, at the end of the day, as a nurse, you stay confident in yourself. Okay, so in conclusion, building those relationships with a patient will make you love your job way more. It will help you have a healthy work environment, because at the end of the day, you want to be at a job where you feel comfortable with yourself, where you feel happy, and it's just a really healthy work environment overall. My point with this topic, building a trust between the patient and a nurse, is really because that's what I want to do. So I intend to hopefully graduate from STC to become a nurse. That way I can help others in that field, because I, as the patient at one point, know what it's like to be helped by someone that's not too kind with you, and it just makes your life miserable. You're already miserable because you have to be hospitalized, so imagine adding nurses being rude to you. It just makes it way worse. So just be kind. Whether you're the patient or the nurse, be kind, because kindness will take you a long, long way. Thank you.